We're going to cover some simple exercises going over the 3 planes of motion that your spine's capable of for low back pain. Starting off simple is a pelvic tilt. Hands on your hips, feet shoulder width apart, pushing your belly out and then tucking it in. Pelvis is tilting forwards and back. And you can increase this as much as you want and you can tolerate, really. It doesn't matter. As long as you're getting more movement and loosening up that stiffness, it's heading in the right direction. Beyond this, going further into a range of motion is taking it on all fours and doing a cat-cow, and it's the same thing but on all fours. So you're pulling the belly in, tilting the pelvis back, squeezing the glutes, and then the opposite, dropping the belly down, arching the back, even lifting the head. Again, the further you go with this, the more you're able to tolerate. If it's hard at first, that's fine. Don't force yourself. Just doing a little more each time is really helpful for easing up that stiffness. Now, sticking with this flexion and extension idea, we won't need much equipment, but a chair is always useful. People are always very cautious about bending their spine forwards, but it's something that you've got to learn to build tolerance with. So, I get a lot of people who feel stiff, stuck in a chair all day, to practice those small movements to begin with, and then move on to full flexion. So obviously you can't get this far in a cat-cow or pelvic tilt, but if we can go all the way forward and just let your body be pulled down by gravity, you'll really begin to feel your low back open up. And this can be a really relieving stretch for some people. You don't have to hold it for a long time. If you want to do 5 seconds, absolutely fine. If you're sat down all day, this can feel really good, just to get things moving. Again, let gravity do the work, let it pull you down. You're getting full spinal flexion here. It's not dangerous. It can be really relieving. But then of course we're not getting much extension there, we're only coming back to neutral. So you want to do the opposite. So again, on the floor. Getting down into this position. Keeping the hips down. Getting into a press up position. And coming up. And repeating that movement as much as you can tolerate. Obviously I'm going full range of motion here, but you don't have to. If you just want to go up onto your elbows, that's absolutely fine too. Do what you can manage. So those are for flexion extension. We'll move on to side flexion. Anytime you're side bending, you can do it feet a bit wider than shoulder width, just for sturdy support. And you can start off, if it's feeling really tender and stiff, hands on the sides of your thighs, and getting a little range of motion either way. Yeah? And then, even if that's too much, you can bring it back and just hands on your hips and lift one heel at a time. If that feels a bit more friendly to the low back. And just feeling that pelvis tilting left and right. But just to progress beyond that, going further with the bending. And then if you feel like, in the end, you're getting full range of motion, so that's hands sort of beyond the knee ideally, you can start loading it up, maybe with a band, a dumbbell, a cable, whatever you've got, but concentrate on getting the full movement before you load it up at all. And then we'll move on to a rotation. Again, the chair is a good place to start with this. All the chair does here is stabilize your pelvis. Obviously you're not going to twist in the chair and move your bum, but keeping that still, keeping your legs still and rotating. And you can even use the handles to help that rotation. If it feels a bit limited doing it yourself, do it passively. Bit of an extra stretch. Don't force it, don't strain yourself, but just get a bit more movement in there. And we'll move on. I like to get patients doing this if they wake up stiff in the morning, laying in bed, legs together, rocking either side. Quite a gentle rotation here, and you're in full control really. And if that's easy, straighten one leg out, bring the other leg up about 90 degrees at the hip and knee, bring it across. You hear a few clicks, who cares? It's just joints moving. It's nothing scary. So shoulders stay flat and the hip rotates across, and that's how we get the spinal rotation. You don't have to hold it. If you feel like you want to hold it for a few seconds, that's fine. And do that either side. I'm feeling quite clicky today. Now these are quite low level exercises that can all be progressed, but they're a great starting point when your low back's feeling stiff, tight and sore, and using them to just build things up and get moving again can be really useful. Give them a go.